Can you hear us now?
Yes.
Yes.
Good. Okay. Well, did you hear the resounding applause?
No, but that's nice to hear. Thank you.
Okay. So I'm going to thank you on behalf of everyone here. That was a wonderful, quick tour of some of the terrific work that the two of you and your colleagues have been doing. I mined some of the literature on my flight west, and it's really quite a challenging and fascinating area. So let's open this up and see whether there are questions from members of the audience. And somebody's walking down. Is that you, sir?
Hi, Jeff. Can you hear me?
Yes.
Oh, hi.
I can't see you, but I can hear you.
Your presentation was great, and I actually loved your paper, Message Design Strategies. That, anyway, I read it before I came. So I'm not part of the Population Health Roundtable, nor am I a scientist, nor am I, I'm just sort of an advocate. But it was interesting. I just wanted to comment, and I do think this is a long slog to you guys that you guys have set out to accomplish, but with the payoff being kind of changing the world, it seems to me. Though I'd like a comment, because I think it's interesting you brought up the analogy of gay marriage. So I'm gay, and I actually never thought in my entire life I would see all these tectonic plate change shifts in my lifetime. However, what started it for, I'm going to give you, just throwing this out to a public health communication expert with a comment. 25 years ago, we started National Coming Out Day. That has been, I think, one of the biggest caused one of the biggest changes, and why it's caused the change so rapidly. If you know someone who's gay, your opinion changes about it. So I'm wondering, is there an analogous thing here with population health and that sort of National Coming Out Day? Though I don't suppose we call it National Coming Out Population Health Day, but does that make sense?
Yeah, it's a great question. Oh, yeah, absolutely. And I would echo what Bob said earlier about the kitchen sink approach. And that is to say, the evidence, I think, pretty clearly suggests that communication campaigns or messages, broader media context, work better when there are sort of support for that coming from interpersonal channels and events and, all sorts of other policy changes along the way. So, I think we can't think about this as simply let's design these sort of high-level messages and then hope things change. I mean, I think coalition building, I think action on the ground, I think events and promotion are great ways to expose people to new ideas. Sarah, thoughts?
Yeah, no, I think that's right. I'm not sure what the analogous sort of personal touch is to the experience of coming out and finding out of who's close to you in your community. But I think that what you're getting at, though, the sort of the concept behind that is that personal communication matters a great deal. And I think if we think about these campaigns that we're talking about don't end with the individual audience member, because we're also concerned with sparking conversations in others. And so maybe it's not so much that there's a direct analogy to Coming Out Day, but that we want to think about measuring and thinking about conversations that are being instigated and led in among small groups and social networks around this topic as an important strategy for seeing change in these outcomes.
One of the areas, just to parenthetically add, is this whole area of public deliberation, where people are brought together from large cross-sections to think about a problem together that sort of taps into their values. And I think what I've noticed in many of these deliberations is a real sort of sharing of ideas from people who would not normally have any understanding of other people's circumstances. And there are some really incredible moments that happen as people have a sort of the aha kind of piece of personalizing that information. David?
Dave Kindig, University of Wisconsin. Hi, Jeff and Sarah.
Hi.
There was a lot in your, we've had some conversation about audiences here today, and realized that we haven't, as a roundtable, necessarily done all the work we need to do in sort of figuring out what our primary target audiences are. I mean, a lot of your work that you showed us showed differences, say, in political ideology, but what's the state of the art on, say, what kind about message effectiveness to different types of audiences, such as the general public or legislators or executives or media? Do we know much about that?
Sarah, you want to go first?
No, Jeff, I'll defer to you.
I think the answer is we don't know to some extent. Although a lot of, I've done some limited work with policymakers and asking them, similar questions in the case of the work that I've done, largely at the state and county level. And, responses to the messages we were sort of trying to understand and general sort of associations between perceptions of responsibility and cause and support for policies tend to be pretty similar between general public and at least state legislators. Now, that said, I think in the earlier discussion about connecting with journalists and forging personal relationships, I do think that's that's what lobbyists do when it comes to policymakers. And I think a policymaker has 8,000 people wanting to persuade her or him about how they should spend their time thinking about an issue, what they should spend their time advocating for, what they should spend their time promoting. So I do think there's absolutely a need to make those personal connections, in particular with folks in positions of power, and that takes time. Those relationships are built over time. It's not a one-shot deal. But I think it's something we don't know enough about as well.
Sandy?
Yeah, Sandy Magnan from ICSI in Minnesota. Hello. So my question shifts a little bit into the third goal of the roundtable, decreasing per capita cost of healthcare, and also into this some of what you shared about unintended consequences. And I think about a study that was focus groups that were funded by RWJ, looking at whether consumers, patients, how they felt about their doctor talking to them about cost. And no matter which way the doctor went about talking about cost, whether it was shared decision making or appealing to societal issues, patients did not want their doctors talking to them about cost. And in fact, after the focus groups, they were more opposed to their doctor talking to them about cost, if I remember it correctly. So my question to you is twofold. One, is there any way to know about unintended consequences without doing formal research and focus groups? Is there any way to know about that? And then second, what do we know about engaging different audiences about addressing cost in healthcare? It's kind of in a different way, but so those are my two questions.
Sure, I'll take a stab. So the question about unintended consequences is tough because, if you don't set out to look for it, you don't see it. And so it's hard to know how to predict an unintended consequence, except I think through, examining precedent and past experiences is one way to do it. But I do think that research that begins a priori to want to investigate those unintended consequences of communication is probably the best source of evidence on making those predictions. But Jeff can potentially speak more to that. About engaging audiences around healthcare costs, Sandy, you and I are familiar with that same body of literature that suggests that costs has a certain toxicity associated with it because people both link costs and quality still. So people think that higher cost care is higher quality. And so as soon as you start talking about costs, I think people go there and worry about getting substandard or lower quality health care. And I think that's a real barrier, for one. to engaging costs in the conversation, and then part of that comes from people are accustomed to thinking about healthcare as a consumer product, where they can purchase it. And so I'm not as familiar with the literature on sort of some of the medical anthropology or sociology on how people think about health care. But I do think that those kind of market-oriented tendencies are really strong in people's predispositions and attitudes about health care. So I don't think I directly answered your question, but I sympathize with the challenge and know that the sort of link between costs and the kind of concern, the moral concern about rationing, is very strong, and that's, I think, one of the touchstones that is really critical for communication research to consider.
Yeah, the only thing I would add about about unintended consequences that we're often, I mean, as Sarah pointed out, not in a position during evaluations of communication to really detect them, because the person who's funding an evaluation is interested in those outcomes. You have limited space in your research survey. So we know a lot about boomerang effects, which is when campaigns or messages have the exact opposite effect intended, because you're measuring that outcome. But in terms of other kinds of unintended consequences, do you take attention away from another issue that might be more important, for instance? Do you mobilize the opposition? I think we know somewhat less. Although I do think, Sarah pointed out in some of her work, there is good social science theory out there and research to help us think about when that might happen. So this idea of priming group differences. Well, if people have stereotypes about a particular group and we communicate about that group, I think that we need to think about whether those stereotypes are going to get in the way of effective communication, or how do you handle communicating? Do you have to offset those stereotypes explicitly in the message? So I do think even if you don't do testing beforehand, there's thinking about it at all is a good first step.
I think I'll just add one more thing to that, which is also that in the literature around message processing and kind of motivated reasoning processes, there are a few metrics that have been identified that signal when people are going to have a boomerang effect, and so there are intermediate outcomes that you could measure even if you're not going out to measure opinion or belief change, if that makes sense. So, for instance, when a message makes people mad, when a message makes people counter-argue and have negative thoughts about it, that's usually a pretty good sign that you're not going to see movement in the sort of direction the communicator hopes to see. So if that makes sense, so if you can be positioned to kind of look for those kind of intermediate emotional and attitudinal reactions, that can sometimes be a good sign that things are not going in the right direction.
Thank you.
Mm-hmm.
Pam?
Hi, Jeff and Sarah. It's Pamela Russo. I've been perseverating all during your talk on one of the early things that you mentioned, which was I think a study you did with Elizabeth Rigby on how if you framed it as income disparities, there was more support for policies in which the government would support or intervene. I wasn't quite sure what that meant. Mm-hmm. But not for racial disparities, which is striking because it means that people don't have an association between minority status and income. But would you suggest that we reframe our disparity conversation to be around income disparities? Being provocative here?
Yeah. Well, I think that in a way that was one of the conclusions of the How to Talk About the Social Determinants of Health report, was the sort of discussion that it's so challenging to talk about race for a variety of reasons. I personally don't go there for a reason you just alluded to, that we want to make clear that there is such a strong connection between race and social disadvantage of other types, and that these are intersecting identities. They can't necessarily be so easily distinguished that you can talk about one and not the other. But I think that one of the reasons that the Rigby study found what she found was that people had really different attitudes about why racial differences exist than why income differences exist. And so it could be a role that communication could actually help address in explaining those links. So, for instance, people believe to this day that differences in life expectancy, for instance, when you look by gender or by race, are more biological, whereas they don't think the same. They don't think that those differences are reified by biology or income. And so that's sort of a psychological reason that you might see different responses depending on the type of group you identify. And it also shows that there could be a role for more information and education to change how we understand the causal relationship between for group differences. Does that make sense?
Yep.
Yeah, Pam, I would say the costs far outweigh the benefits. Maybe not in the short term, but certainly in the long term. If we frame the issue in terms of income inequality exclusively, we're leaving out all of the other factors that contribute to racial disparities, discrimination in all aspects of life. Fundamentally, I think, and not having that conversation, might be easier in the short term, but I think has long-term negative consequences associated with it for obvious reasons to those interested in social justice. So, it's tricky, but I think the long view is the right one there.
Right, and the pathways really are different. There are certainly some similarity to the pathways explaining, or the mechanisms explaining group differences by income or by race. But right, you have this added historical element. You have the experience of structural factors and discrimination that I think are really important and distinct.
Paula, you're going to take the last question.
Hi, Paula Lana. George Washington University. Hi, Sarah. Hi, Jeff. Great to hear you. Hear you sum up all your great research in such a nice fashion. I actually wanted to continue this thread that we're just having. Political scientists have been telling us for decades that policy acceptance and movement has a lot to do with whether or not the public and policymakers see the populations getting the policy as deserving or not. I think that's pretty much what we're talking about here. Quick little anecdote, I learned the other day that 19 states in the last few years have passed legislation that requires women who get mammograms and they're labeled as having dense breasts get notified for that. So, this is just proliferating through state legislatures, and because it's about women and breast cancer and it's very much considered a deserving population, there's lots of policy attention being given to that, and we can have lots of examples. When we start talking about populations, and you gave lots of examples in your work that are thought of as less deserving, I think that's where our real challenges in communication are. Our journalist friends who are here with us today told us this morning we should talk about children and, think about groups that people care about. And I get that and I understand it, but if we're really going to move the needle on population health, we are going to have to address issues that are affecting populations that are marginalized, that don't have a voice. Jeff just used the phrase social justice. For a lot of us, that is what this is about, but we can't go around talking about that because that would really get into political, ideological differences. So I'll shut up. But I think that's our biggest challenge in all this.
Thank you. So I'm going to take the last few moments to hit some summary points that I think emerged from these presentations, and if I do injustices to Jeff or Sarah, I'm sure they'll jump in. I heard that there's an uphill struggle to move Americans' thinking away from individual responsibility, and yet we're going to have to do that if we're going to make changes in the determinants of health. We know that social and environmental causality is complex, and it's very difficult to package it succinctly. And that there are very powerful counter-arguers who are much richer than the resources that we have. We have to have messages that reach several audiences: the public, health professions, decision makers. In some cases, we need only to mobilize. In others, we need to persuade, and persuading can be tricky. Raising awareness is not sufficient always to provoke action. The messages that we give need to resonate with broader values. People's politics tend to influence the degree to which they are predisposed to consider social and environmental determinants of health as important factors in creating disparities and poor health. It's possible to alter people's responses to messages based on how information is conveyed. That's a good thing to hear. Narrative that acknowledges a moderate amount of personal responsibility together with facts may be the best overall strategy. But political beliefs and underlying values interact with how people from different ideologies hear the same message. So it's not always predictable what's going to happen. Countering messages, counter-arguing, and messengers can be a big problem. The phrase, don't wake sleeping giants, I'm thinking of the whole sugar-sweetened beverage industry problem in New York State, where we couldn't get legislation through, and the people who were most affected by obesity and sugar-sweetened beverages, often the African American community, had the NAACP, which was funded by industry, come out in favor of, opposed to the tax. The traditional media has been slow to engage social determinants of health, and we heard some of that this morning in the journalist panel. We heard some discussion of sort of terms that don't resonate with people, that turn readers off. But Jeff and Sarah seem to think that this may be changing, and it's certainly important for us to be able to find the language of population health and social determinants if we're going to change public perceptions and affinities toward healthcare and health and the relative value of where we place our investments. Anything else that either of you think needs to come back at the audience?
Well, that was a terrific summary, Martha. I would just also make sure Paula's point about this being fundamentally about populations that have different, that we think of differently in society as more or less deserving is an important communication challenge as well.
Thank you.
I thought that was great, Martha. Maybe you should have given the talk, and you could have had a coffee break earlier. Very succinct.
I had so much fun reading your pieces, and I really would suggest people to take a look at the very wonderful articles that are in the bibliography. They're very, very deep, and they do show you how many damn hypotheses you need to test. I've never seen so many hypotheses tested in one particular article. But thank you, and we wish you were here with us to have informal conversations, but thanks for joining us.
Thank you so much.